So you have just downloaded an article and you have started reading it. Now after 10 seconds, you might feel confused. You don't know how to approach the entire article, how to critique and analyze the entire article and their results. At the same time, there are some terms that are haunting you like p-value, standard deviation, mean, median, and all of those things. Then this video is for you. So hello and welcome back to PhysioAlchemy, where I teach tough concepts in a simple manner. So today we are going to learn about how to approach the article and how to read the articles in a better way. At the same time, I'll be teaching you about the different terminologies that are haunting you from very long. At the same time, I will also teach you how you can decide whether this article is beneficial for you or not. And I will also teach you how to decide whether this research that you are reading, it is really applicable for you. Is it a good research or not? Does it show what you actually was looking for? And does they address the research gap which they have mentioned in the aims and objective, and do they justify them in their result and discussions or not? So I will be teaching you the entire process with a live article on your screens. As you can see, I'm using a plantar fasciitis article over here. So without any further delay, let's start the video. So the first and foremost is your topic. So you will jump into the topic. As you can see, the topic that we have is to compare the effects of different time ratio of heat and cold in contrast bath on clinical improvement in plantar fasciitis. So with the very first information, that is compare, that means it is a comparative study. So they are comparing different time ratios of heat and cold in contrast bath. So suppose like we give 2 minutes of heat and 4 minutes of cold, or 4 minutes of heat and 2 minutes of cold in plantar fasciitis, your contrast bath. So similarly, they are not looking for whether your contrast bath is beneficial for plantar fasciitis or not, but rather than they are looking what is the ideal, or what are the effects of different time ratios if we jumble up some bit of time of your heat and cold for the plantar fasciitis, okay, on the clinical improvements in the plantar fasciitis. So they are looking for clinical improvements. So the findings of this research might help you in your clinical practice as well, at your clinics and your OPDs. That they already know that the contrast bath will work on and it works on the plantar fasciitis. So this is not the entire agenda of them. They are looking for which timing works the best for the contrast bath. So this is the first step of reading. Always decode what the study is comparing and in which population they are comparing. Now then comes your abstract. Now your abstract is very much important. This will help you to decide whether you want to continue with this article or not, whether you are going to read it or not. At the same time, your article is just like a movie trailer. Okay, so this will give you the gist of everything they have done in this article. But again, do not blindly trust on the abstract itself. You should be looking and checking the data, what they have shown in the abstract, that should match with the results and discussion and conclusion as well. Okay, so you need to be checking that in the end. So in the abstract, first of all, we have is the background. So they have made a clear statement that contrast bath is commonly used in the therapy of plantar fasciitis, that we already know. However, there is no standard regime followed as order and time ratio of hot and cold fermentation. The study was concluded to establish a standard hot and cold fermentation ratio to achieve maximum efficacy of contrast bath in the plantar fasciitis. So they are not looking whether it is working or not, the contrast bath is working on the plantar fasciitis or not, but they are looking for the standard regime time for the contrast bath. So that what can be the ideal time of submersion in cold and in the hot for the better outcomes on the pain, because they have they're checking the VAS score. As you can see in the materials and method, they have mentioned VAS score, that is used for the pain outcome. Okay, so then you come with the materials and method. This is very much important. So as you can see, they have used 75 patients of the plantar fasciitis. So this will also give you an idea whether this article is reliable or not. Okay, so if they have small population like 10, 20, 30, 40 population they have included, then it is not that much reliable. But above 70, or you can say above 100, it is more going towards the reliable data. So they have included 75 patients of the plantar fasciitis, and they have equally divided them in 3 groups. So what are the groups? As you can see, they have divided group A, 3-minute hot submersion they are giving and 1 minute of cold, 3 cycles per day. Then 3 minutes of hot and 1 minute of cold, then followed by 12 minutes of hot submersion in group B. And in group C, they have done 5 minutes of cold submersion, then 2.5 minutes of hot, and then 5 minutes of cold submersion again. So these are the three groups. They have divided equally the patients, and what they are checking, they are checking VAS score. That means they are checking pain outcome at initial pain relief at day 1, week 1, and then 1 month. Okay, so they will be comparing the pain data in the three of the groups. So the next topic is your results. So then you will come on to the results. As you can see, the mean pain value in group A was 7.52 plus minus 1.27 standard deviation. So do not get confused with 1.27 standard deviation. I will tell you about that. Right now just focus on 7.52. So in group A, all the participants they were having, okay, in group A, their average pain value was 7.52. So if suppose if you have a patient, 5 patients, like they have pain score of 8, 7, 9, 8, 6. If you divide them by 5, you will get 7.6. So that is the average pain value. Similarly, what they have done is the mean or the average pain value in group A was 7.52 on initial evaluation on day 1. Okay, when the treatment was started, as you can see, 6.32 at the 1 week. Okay, so at 1 week it was 6.32 and 2.8 in the at the 1 month duration. That means the pain score is now decreasing. That means we are getting the positive results in group A. Similarly, you will check the respective values of the different group from B. As you can see, 6.8 first we are getting, then we are getting 5.8, and then we are getting 2.6 over here. That means again in this group also getting positive results, and in group C 7.81, then 6.37, and then in the end we are getting 3.1. So this group, the group C, also showing us the positive results. So three of the groups are showing us the positive results with their different time duration of the treatment. That means all the three groups have benefit after the contrast bath. Let me teach you about the standard deviation. So as you can see in the first value for group A, we are getting 7.52 plus minus 1.27. Now just for instance, take it as a 7 and here take it as a 1, just for instance. Now you have to understand standard deviation shows how spread the data was. Okay, and the smaller the standard deviation, that means more consistent results were there, and the larger the standard deviation, that means that were not consistent or regular. So suppose if we got the value over here is 7, okay, the mean value is 7 and standard deviation of plus minus 1, that means 7 plus 1 is 8 and 7 minus 1 is 6. So from mean value of pain 6 to 8 we got the results in group A. So on the initial screening, when the pain was checked, the pain was from 6 to 8, not more than 8 and not below 6. So this was the criteria, this was the zone in which pain value we got for the group A. Okay, and similarly you will do it for each and every group for the standard deviation. Okay, you just have to plus and minus the exact same value which is given for the standard deviation, and you will get to know what is the zone that you are talking about. So the larger the zone, that means more inconsistent results were there throughout the group, and the narrower the standard deviation, that means more consistent results. So if the patient are getting pain levels of 7, 6.5, 6, so they are very closely bounded. Okay, so all the patients having same pain, and on the end day, suppose everyone is having 2, 2.5, 3, 2.2, that means they are very close again. But if they are showing 2, 5, 4, 3, 7, that means they are more broadly assigned. Okay, so not everyone had the good results on that group. So this is the exact idea of your standard deviation. Now then comes your discussion part. As you can see in the discussion, they have mentioned in plantar fasciitis only temperature fluctuations at subcutaneous level are required to bring the local pumping effect. So as we all know, in contrast bath therapy, the local pumping effect is there because of the vasodilation and the vasoconstriction. So they are saying that only alteration of hot and cold fermentation is required. That means just the alternation is required. The order of the fermentation and time duration of the each cycle is not specific. So whether you use cold first or hot first, it does not depend on that, because all the groups have the positive results. Okay, at the same time, time duration, at what time duration you are keeping for hot and cold, it is also not specific, because in 3 of the groups we have seen different time zones were there, but still they all got the positive results. Only we have to see which group had the best one in the upcoming reading of the article. And in conclusion, as you can see, they are mentioning no time ratio is superior to another. So they are concluding that no time ratio is superior to the other one. You can use any of them for your better results in the patient, because all the groups had the good results in this article. Okay, so now let us deep dive into the article. So the first part is your introduction. Now you see, you have to read the entire introduction if you want to, so you should be going by yourself, but I am highlighting the exact same point. You have to understand what is the need of your introduction. The introduction will always look for why this study was needed. Okay, so you have to look in the introduction why this study was done and why it was required. So as you can see, normally what we use is the hot and cold ratio of the 3:1. That means 3 for 3 minutes hot and for 1 minute cold submersion, repeated for 3 to 4 times a day. Now, however, there is no standard regime followed as to the ratio of hot and cold fermentation time. That means the idea of this research and the research question is that they are moreover towards the finding of a standard regime. They want to set a standard regime. Now then comes your materials and method, again a very important part. So you can see the material and method section will tell you how the study was conducted, so you will get each and every detail over here. So as you can see, they have mentioned where the study was carried out, which state and which hospital, and all of those things that you need to read. At the same time, they are also given the diagnostic criteria. That means the inclusion and exclusion criteria, which patients they included in the study and which patients they did not include in the study, that can give you poor results or poor outcomes. So as you can see, patients who had pain in their heel more so in the morning causing discomfort to the patients in weight bearing, they were included. Tenderness in the heel pad, they were included, and exclusion of all the other possible causes of pain in the heel. So if there was any other cause of the heel pain, they were excluded from the study. So in exclusion criteria, you can see the patient with known cause of plantar fasciitis, such as flat feet or due to some other deformity in the foot, they were straight excluded out of the study. Patient who had previously received any kind of injections, they were also excluded. And patient with known inflammatory pathology like rheumatoid arthritis or ankylosing spondylitis, they were also ruled out and excluded from the study. So we are just keeping a very very unified group that have true plantar fasciitis, and it is not secondary to any other problem. So this also gives us a very good information about the research or this article, that they have not shown any kind of bias in that, and they have only included the pure plantar fasciitis patient without any other causes. Okay, then we have is the patients. Okay, so we already know 75 patients were included. At the same time, they were divided in 3 groups, that we already know. And what was the different treatments they have included. So what were the different time zones for hot and cold fermentation, that we already discussed. Okay, then you will come on to below region, and you will see they have mentioned groups were randomly assigned, equally divided into 3 groups, and double blinded randomization was done. This is a very important point for any research. Now, what is a double blinded and single blinded means? Double blinded means both your patient and the assessor who is assessing the results and the data analysis who is doing, both of them did not know in which group which patient was assigned. So this reduces the bias in the research. If it is single blinded, that means only the patient did not know in which group he was placed. Okay, but the assessor knows about which patient was assigned in which group. So this can sometimes create the bias. If I am assessor and I'm favoring some certain kind of group or certain kind of patients, so that can hinder your results. Okay, that can produce the bias in the nature that we don't want. So if your study shows double blinded study, it's a good study. You should be it's a very reliable study, so you should be moving forward with the rest of the part. Now the moment you will move forward, you will see they have also mentioned some of few of the details, like that all the patients irrespective of the group, okay, a compliance sheet was provided to all the subjects that they were supposed to take. So every day they need to they are supposed to take a sheet in which whether they have done the contrast path or not, and if somebody was not following up this all the things, then they were excluded from the study. Then you can see, apart from this, a common conservative protocol was followed for all the patients that included change in shoe wear, plantar fascia, okay, and tendinoachilles stretching was also included. At the same time, analgesics SOS. Now we see that they have also given the some shoe wear modification was done in all the patients. Stretching was given. At the same time, some analgesics SOS. That means now this will click in your mind that there might be some things not looking that much great, because they have also used the analgesics. Okay, so this creates a clear impression that I'm thinking that this results that we are getting in this entire study, are they generally from the contrast path, or it is coming from the analgesics? So this you need to keep in your mind while reading the articles. Okay, so as you will move forward, as we have already discussed, that they had 3 groups, and after that they have checked the pain level on day 1, then week 1, and on the 1 month. And the end, you will see that they have used the statistical tool to analyze their data as your ANOVA. So what is ANOVA? ANOVA test is used when there are 3 or more than 3 groups are there, like in this case. Okay, so we have different tests like paired t-test, unpaired t-test, ANOVA, but for that I will make a separate video that what are the different meanings of different tests. So think of ANOVA like we are comparing the average of 3 class tests. So suppose there were 3 class tests done. In first class test you got 2, in second you got 3, and in third you get 10. Okay, that means there is a significant difference. This we call it as a significant difference in the ANOVA. Okay, suppose you got 2, 2 and 3. So it is non-significant because it is not having a great significant difference. Okay, so this is called as non-significant, and having a great range, it is called as your significant. So think of your class test, the 3 of the class test that I mentioned, think of it as a 3 groups that we have in this article. Okay, so are the average value that we are getting in 3 of the groups having a significant difference? Like one group is having pain reduction towards 2 from 7 to 2, and the one group from 7 to 5. So it is a significant difference. Okay, but if all the groups are coming close to the 2 or 3, that means it is non-significant. Now then comes your result part. So as you can see, in result they have again mentioned 75 patients, 48 had bilateral heel pain. So now they are mentioning that how many patients had right side problem, how many have left side problem, and how many have bilateral problems. So you can see extremity involved right, left, and bilateral. So in group A, 5 of were with the right, 3 for the left, and 17 with bilateral plantar fasciitis. And similarly they have explained for the rest of the groups. And then they have mentioned the sex ratio, or the male to female. So you can see in group A we had 17 male, then 8 females, then we had 13 males in group B and 12 females, then 15 to 10 females. Okay, then you will read all of these things. They have explained the exact same thing on the paragraph itself. Okay, and then comes your some standard deviation and the mean again. So on initial evaluation, the patient, that mean pain value, the average pain value in group A was 7.52. okay, then in group B was 6.8, and group C 7.81. so they are very close to each other. Okay, all the patients in the 3 of the groups, their initial pain was somewhat around 6 to 8, in between 6 to 8. Okay, comes your important part for the result is your tabulation. So in some articles you will see the graphical representation will also be there. In some you will see only tabulation will be there, and some in combination. So you see, first of all they have showing us demonstrate the initial pain at 1 week of the therapy and 1 month. So they are comparing the entire timeline of their contrast path and the pain. So first of all you will look for the group A, okay, then group B, and then group C. So first of all you see the initial pain. Okay, initial pain or the initial assessment when was done. So there was in group A 7.52 on VAS scale. Okay, in group B it was 6.8, and in group C it was around your 7.81. so there is not a large difference between them. That is why non-significant. Even the standard deviation is also very small, so it shows the wide rangeability is not there. Okay, they are very closely bounded. All them have same kind of initial pain. After 1 week, what we see 6.32, then here 5.8, and then 6.37. Then again a small standard deviation. That means after 1 week of treatment, again there is not a great significant difference between all of them, but yes, the pain reduction was there. From 7.52 it is 6.32 in group B, from 6.8 to 5.8, and in group C from 7.81 to 6.37. so the pain has reduced. So all of them has positive results, but if we compare three of them, there is not a much difference between three of them, so we cannot decide which treatment was good enough. Okay, and after 1 month you see the significant reduction of pain is there if you compare 7.5 to 6.32 and 2.8 in group A. Okay, then in group B 2.6, and in group C 3.1. so in all the groups the pain has reduced significantly. That means shows contrast part really works on the plantar fasciitis. But is there any statistical major difference between all the three different regimes? No, non-significant difference is there. Next we are looking at again a very important data in the result part, that is demonstrates the number of patients with a significant relief. So as you can see in this tabulation, you can see the number of patients with a significant relief were in group A 16, in group B 17, and group C 15. so a larger number is there, and there is not a much difference. Like in some if in group A we were having 16 and in group B they were only 5, then there is a difference. So we can think that the group A treatment was much better. Okay, but you can see there is not a much difference between all of them. Number of patients with some relief 566, and number of patients with no relief is 4, 2, and 4. So here a small number is coming in group B. Okay, although not a much difference. Then comes your discussion part. So in the discussion part you will read about how they have compared their findings with the other researcher and other article findings as well. Like if someone also have similar kind of findings in the past, so they will compare the both of their ideas, and you will have a a greater aspect in reading terms, so we will understand better. If you read the discussion part you will understand it better. So they are clearly mentioning in the discussion part, as you can see, the contrast path along with a simple conservative method brings a significant pain relief, okay, in the patient of plantar fasciitis, but no time ratio is superior to one and another. Okay, so they have compared group A, group B, and group C with different cycles of the treatment duration, but they have found out that there is no such duration that is superior to the other one. Okay, and then you will read out the entire thing in discussion, which I'm not going right now. Okay, and then comes your conclusion part, that contrast path should be recommended for the all patients with plantar fasciitis, but no specific time ratio is recommended. Okay, patient may choose it according to their convenience. Okay, so in this article we have find out that there is no specific time duration for the contrast bath, that how much cold and how much hot is there. Only it says that the interchangeability should be there with hot and cold to get the results. And now you will ask yourself a question, that is this article is valid for you? Are you able to incorporate this in your physical practice, in your clinical practice or not? Is this article really biased? Like we see the double blinded study it was, so it is not that much biased. But there is one point that is clicking in my mind, that is about the analgesics. So they have also used the analgesics, so that this might create an impression in my mind that might be the contrast bath have worked or might not be. In some patients maybe the analgesic effect is also there. Okay, so this is one point that stays in my mind. So these are the things that you need to tell yourself about this article, and then you decide whether the things that they were looking for this in this article, they have actually found it or not. So if you like this video and my teaching methodologies, and do share a like and comment in the comment box. At the same time, do follow PhysioAlchemy for more educational content like this.